The fluorescent lights buzzed overhead in the emergency room of St. Mary's Hospital as Sarah Mitchell checked her watch. It was nearly midnight, and the chaos of Saturday night was just beginning. She had been a nurse for 12 years, but tonight felt different somehow. Sarah moved quickly between patients, her sneakers squeaking against the polished floor. She had learned long ago to keep her emotions in check, to focus on the task at hand. Her colleagues respected her, patients trusted her, but she always felt like she was living in the shadow of something she couldn't quite name. Dr. Marcus Webb strode into the trauma bay like he owned the place. At 38, he was one of the youngest head surgeons in the hospital's history, and he never let anyone forget it. His expensive shoes clicked against the floor as he surveyed the room with the confidence of someone who had never been told no. "What do we have tonight?" Dr. Webb asked, not really looking at Sarah as she approached with a chart. "Car accident victim in Bay 3, Sarah replied calmly. 24-year-old male. Possible internal bleeding. Vitals are stable. But we need to watch for— I can read the chart myself, nurse, doctor," Webb interrupted, taking the clipboard from her hands. "Just make sure the patient is prepped properly. I don't need medical advice from someone whose biggest decision is which bandage to use." The other nurses in the area shifted uncomfortably. This wasn't the first time Dr. Webb had spoken to Sarah this way, and it wouldn't be the last. He seemed to take particular pleasure in reminding everyone of the hierarchy in the hospital. Sarah bit her tongue and nodded. "Of course, doctor." As Dr. Webb walked away, her friend and fellow nurse, Maria Santos, appeared at her side. "How do you stand him?" Maria whispered. "If he talked to me like that, I'd throw a bedpan at his head. It's not worth it." Sarah replied quietly, though her hands trembled slightly as she organized her supplies. "He's not wrong. I'm just a nurse." But even as she said the words, something deep inside her rebelled against them. There was so much Dr. Webb didn't know about her, so much no one at the hospital knew. Sometimes, she caught herself reaching for skills and knowledge that went far beyond anything she had learned in nursing school. Muscle memory from another life that she had worked hard to forget. The evening continued with its usual rhythm of controlled chaos. Sarah moved from patient to patient, administering medications, changing dressings, offering comfort to frightened families. She was good at her job, better than good. But she always held something back, never quite letting herself shine too brightly. Around 2 a.m, the ambulance sirens began wailing in the distance. Sarah looked up from the elderly patient she was tending to, her instincts suddenly alert. There was something different about these sirens, something urgent that made her heart race. "Incoming trauma," the dispatcher's voice crackled over the intercom. "Multiple GSWs. 1 critical. ETA. 3 minutes." Dr. Webb appeared immediately, straightening his tie and calling for the trauma team. "This is what separates the professionals from the amateurs," he announced to no one in particular. "Time to see some real medicine." Sarah found herself assigned to assist in Trauma Bay 1, the most critical case. As the ambulance doors burst open, the paramedics rushed in with their patient, a man in his early 30s, unconscious and covered in blood. Multiple gunshot wounds to the chest and abdomen, the lead paramedic reported breathlessly. Lost consciousness en route. Blood pressure dropping fast. "We've got maybe minutes before we lose him." And, Dr. Webb immediately took charge, barking orders as they transferred the patient to the hospital bed. "Get me 2 units of O-negative stat. I need a chest tube set up and prep for emergency surgery." Sarah moved efficiently around the room, her hands steady despite the chaos. But as she helped cut away the patient's shirt, she noticed something that made her freeze. Around the man's neck was a chain with a distinctive pendant, a gold trident that she recognized immediately. Her training kicked in, and she forced herself to focus on the task at hand. But her mind was racing. The pendant meant this man was Navy Special Operations, probably a SEAL, and if he was here, in this condition, something had gone very wrong. "Nurse!" Dr. Webb's sharp voice cut through her thoughts. I asked for gauze. Not a daydream. Sarah quickly handed him the supplies. But she couldn't shake the feeling that this case was about to become much more complicated than a routine trauma. As Dr. Webb worked to stabilize the patient, Sarah noticed the man's eyes flutter open for just a moment. They were clear blue, alert despite his condition, and they seemed to focus directly on her. His lips moved slightly, but no sound came out. He's coming around, Sarah said quietly. Impossible, Dr. Webb replied without looking up from his work. He's lost too much blood. Must be involuntary movement, but Sarah knew better. She had seen that look before. The focused awareness of someone trained to assess threats and allies even in the worst circumstances. She moved closer to the patient's head, pretending to check his IV line. The man's eyes found hers again, and this time she was sure he was conscious. His lips moved again, and she leaned in slightly, careful not to draw Dr. Webb's attention. Help, the man whispered so quietly that only she could hear. Sarah felt a chill run down her spine. Something was very wrong here. Something beyond the obvious trauma. The way the man looked at her, the urgency in his whispered words, triggered memories she had spent years trying to suppress. Vitals are dropping, Maria called out from the monitors. Blood pressure, 60/40, and falling. Dr. Webb cursed under his breath. This is too much blood loss. We need to get him to surgery now, or we're going to lose him right here. As they prepared to move the patient, Sarah made a split-second decision. She grabbed an extra bag of saline and discreetly adjusted the IV drip. Using a technique she wasn't supposed to know. It wasn't much, but it might buy them a few extra minutes. The patient's eyes found hers one more time as they wheeled him toward the elevator. This time, his whisper was even fainter, but the words sent ice through her veins. They're coming, he breathed. Dr. Webb was too focused on the medical emergency to notice the exchange, but Sarah felt the weight of those words settle over her like a familiar, unwelcome blanket. She had left that world behind 12 years ago, had built a quiet life as just another nurse in just another hospital. But it seemed that world wasn't quite done with her. As the elevator doors closed and the patient disappeared upstairs, Sarah found herself scanning the emergency room with new eyes. The late-night quiet that had seemed peaceful moments before now felt ominous. Every face was a potential threat, every shadow a place where danger might be hiding. Maria appeared at her side again. You okay? You look like you've seen a ghost. Sarah forced a smile. Just tired. It's been a long shift. But as she returned to her other patients, she couldn't shake the feeling that her carefully constructed normal life was about to be turned upside down. The man upstairs wasn't just another trauma patient, and his presence here meant that the past she had worked so hard to escape had finally caught up with her. She had no way of knowing that in the next few hours, Dr. Webb's condescending attitude would be the least of her problems, and that the wounded SEAL upstairs was about to reveal secrets that would change everything she thought she knew about her own life. The surgery had been successful, but barely. Dr. Webb emerged from the operating room 3 hours later, exhaustion evident on his usually pristine face. Sarah had been waiting outside, officially to check on the patient's status, but really because something about the wounded man's words wouldn't leave her alone. Touch and go, Dr. Webb announced to the small group of nurses. 3 bullets removed. 1 nicked his liver. He's stable for now. But the next 24 hours are critical. He paused, looking directly at Sarah. I suppose even a nurse could have figured that out. Nurse. Sarah ignored the jab. Is he conscious? In and out. Heavily sedated. So don't expect any meaningful conversation. Dr. Webb stripped off his surgical gloves. I'm going home. Call me if there are any changes, though I doubt our hero here will be saying much for a while. As Dr. Webb left, Sarah made her way to the ICU. The patient had been placed in a private room at the end of the hall, standard protocol for law enforcement and military personnel. 2 security guards stood outside his door, which struck Sarah as odd. Typical police protection was one officer, not two armed security personnel. "I need to check his vitals," Sarah told the guards, showing her ID badge. One of them, a tall man with cold eyes, looked her up and down. "Make it quick. No unnecessary conversation." Sarah felt a familiar alertness creep up her spine. These weren't hospital security guards. Their stance, the way they scanned the hallway, the bulge under their jackets. These were professionals. Military or government, she was certain. Inside the room, the patient lay connected to various monitors, his face pale, but more peaceful than it had been in the trauma bay. Sarah began her routine checks, but after a few minutes, she noticed his breathing pattern change subtly. "I know you're awake," she said quietly, not looking directly at him. His eyes opened slowly, focusing on her face. "Smart. I was wondering if you'd notice." His voice was hoarse, but stronger than she'd expected. "How are you feeling?" "Like I've been shot 3 times, he replied with a weak smile. "But alive, thanks to you. That thing you did with the IV in the trauma bay, that wasn't standard nursing procedure." Sarah felt her pulse quicken. "I don't know what you mean." "The modified pressure technique to increase flow rate without triggering the monitors. I've seen it used exactly twice in my career, both times by military medics with advanced field training." His blue eyes studied her intently. "Care to explain how a civilian nurse knows battlefield medicine?" Sarah glanced toward the door, then back at him. "I think you have me confused with someone else. My name is Lieutenant Commander Jake Morrison, Naval Special Warfare Development Group. And you're not just any nurse, are you?" Jake's voice was getting stronger, more focused. "The way you moved in that trauma bay, the way you're scanning for exits right now, the fact that you spotted those guards outside aren't hospital security. You've got training, military training. You need to rest," Sarah said, but she didn't move away from his bedside. "Those men outside this door aren't here to protect me," Jake continued. "They're here to make sure I don't talk to the wrong people. The question is, are you one of the wrong people? Or are you exactly who I need to find?" Sarah felt the walls she had built around her past beginning to crumble. "I don't know what you're talking about. 3 days ago, my team was ambushed during what was supposed to be a routine intelligence gathering operation. Someone leaked our location, our timing, everything. 4 of my men are dead, and I'm only alive because I was thrown clear by the explosion." Jake's voice grew harder. The leak came from inside, someone with high-level access to classified operations. "Why are you telling me this?" "Because before I lost consciousness in that ambulance, I heard one of the paramedics on his radio. He wasn't talking to dispatch. He was confirming my condition to someone else, someone who wanted to know if I was going to make it to the hospital alive." Sarah felt ice in her veins. "You think someone's trying to kill you?" "I know someone's trying to kill me. And those guards outside aren't here to stop them. They're here to finish the job if I become a problem." Jake struggled to sit up slightly. "I need someone I can trust, someone with the skills to help me get out of here." "Tell me your name." "Tell." Sarah hesitated for a long moment, then made a decision that would change everything. "That's not your real name, is it?" "It is now." Jake nodded slowly. "What was it before?" Another pause, longer this time. "Captain Sarah Elizabeth Chen, Army Special Forces Medical Corps. Served 8 years, 3 tours in Afghanistan, specialized in trauma surgery and tactical medicine." "Chen. I thought I recognized the technique. You were part of the medical team that saved Senator Williams' son in Kandahar, weren't you? When his convoy was hit?" Sarah closed her eyes. "That was a long time ago." "Why did you leave the army?" "Because I got tired of watching people die. I wanted to save lives, not count casualties." She opened her eyes and looked at him directly. "I've spent 12 years building a quiet life here. I don't want any part of whatever you're mixed up in." "Too late," Jake said grimly. "The moment you helped save my life, you became part of it. They'll come for you too, just to be safe." As if summoned by his words, Sarah heard footsteps in the hallway outside, multiple sets, moving with purpose. She moved to the window and looked out into the corridor through the blinds. Dr. Webb was walking toward the room, but he wasn't alone. 3 men in dark suits flanked him, and one of them was talking on a phone. The security guards outside the door straightened as they approached. "We have a problem," Sarah whispered. Jake tried to sit up further, wincing in pain. 5, plus Dr. Webb. "They're almost here. Webb's in on it?" Sarah felt pieces clicking into place. He was very insistent about taking this case, and he made sure to dismiss me. To make it clear, I was just a nurse who didn't matter, because he didn't want you to get too close, to notice anything unusual. "I need to get out of here. Can you remove these monitors without triggering alarms?" Sarah's training kicked in automatically, not without setting off every alert in the building. "But I can buy us maybe 2 minutes before they realize what's happening." 2 minutes isn't enough. It is if you trust me." Sarah moved quickly to the IV stand, making rapid adjustments that would maintain the appearance of normal vital signs for a short time. Then she went to the closet and pulled out a spare set of scrubs and a lab coat. "What are you doing?" "Getting you out of here." "Can you walk?" "I can try." The footsteps were right outside now. Sarah could hear Dr. Webb's voice. "The patient should still be unconscious. This will only take a few minutes." Jake struggled to his feet, Sarah supporting most of his weight. She helped him into the scrubs and lab coat, then grabbed a wheelchair from the corner of the room. "Sit down and act sedated," she instructed. "We're going for a ride." As the door handle began to turn, Sarah wheeled Jake toward the small bathroom attached to his room. It had a second door that led to an adjoining room, a feature she had noticed during her earlier visits. They slipped through just as Dr. Webb and his companions entered the main room. "Where is he?" one of the men demanded. "He should be right here." Dr. Webb's voice was confused, then angry. "The monitors show he's still connected. Check the bathroom. Check everywhere." Sarah pushed the wheelchair through the adjoining room and out into the hallway on the other side. The corridor was empty. Everyone's attention was focused on the commotion in Jake's room. "Emergency exit is at the end of the hall," Jake whispered. "But they'll have people covering all the exits." "Not all of them," Sarah replied, steering the wheelchair toward a service elevator she had used countless times during her years at the hospital. "There's a loading dock in the basement that most people don't know about. It connects to the old tunnel system." As they reached the elevator, alarms began blaring throughout the hospital. Jake's monitors had finally revealed his absence, and the search would intensify rapidly. The elevator descended slowly, and Sarah could hear her heart pounding in her ears. She was making choices that would end her quiet life forever, but something about Jake's story, about the threat he represented, had awakened instincts she thought she had buried. "Why are you helping me?" Jake asked as they reached the basement level. "Because 12 years ago, I took an oath to do no harm. And because something tells me that if you die, a lot of other people will die too." The elevator doors opened to reveal the basement level of the hospital, dimly lit and filled with the mechanical hum of building systems. Sarah pushed the wheelchair toward the loading dock, her mind already planning their next moves. But as they rounded the corner, she saw 2 more men in dark suits standing near the exit, speaking quietly into earpieces. Jake had been right. They had covered all the obvious escape routes. "Back elevator," Sarah whispered. But as she turned the wheelchair around, she saw Dr. Webb and his team emerging from the stairwell behind them. They were trapped, caught between 2 groups of people who clearly meant Jake Morrison harm, and Sarah realized that her quiet life as just a nurse was about to become something much more dangerous. Dr. Webb spotted them immediately, his face twisting into a cold smile that Sarah had never seen before. He called out, "And look who's helping him. I always knew there was something different about you, Sarah. I just never imagined what." As the 2 groups closed in from both directions, Sarah felt the last of her old training surge back to the surface. She wasn't just a nurse anymore. She was Captain Sarah Chen again. whether she wanted to be or not. Sarah's mind raced as the two groups of armed men closed in from both directions. The basement loading dock that had seemed like salvation moments before now felt like a trap. But 12 years of civilian life hadn't completely erased her military training, and she quickly assessed their options. "Trust me," she whispered to Jake, then suddenly pushed his wheelchair directly toward the mechanical room to their left. Dr. Webb called out behind them. "There's nowhere to run, Sarah. We know who you are now." Sarah ignored him, focusing on the heavy door marked, "Authorized personnel only." She had been in this room countless times during her years at the hospital, checking on medical gas lines and equipment. More importantly, she knew it connected to the old pneumatic tube system that ran throughout the building. They burst through the door just as the footsteps behind them quickened. The mechanical room was filled with pipes, electrical panels, and the constant hum of hospital infrastructure. Sarah immediately went to a large maintenance panel on the far wall. "What are you doing?" Jake asked, struggling to stand from the wheelchair. "Getting us out of here," Sarah replied, pulling open the panel to reveal a shaft large enough for a person to crawl through. "This connects to the old delivery system. It'll take us to the parking garage." "You want me to crawl through a tube with 3 bullet wounds? Unless you'd prefer to explain to Dr. Webb's friends why you're still breathing." The door behind them rattled as someone tried the handle. Sarah helped Jake into the shaft first, then followed, pulling the panel closed behind them, just as the mechanical room door burst open. The journey through the narrow passage was agonizing for Jake, but he moved with the determination of someone who had endured worse. Sarah guided him through the twists and turns of the system, her knowledge of the hospital's layout proving invaluable. They emerged in the parking garage 20 minutes later, both covered in dust and Jake pale from exertion. Sarah's car was parked on the second level, but she knew they couldn't use it. It would be too easy to trace. "There." Jake pointed to a maintenance vehicle parked near the emergency exit. "Can you hotwire a truck?" "That's not exactly something they teach in nursing school," Sarah replied, but she was already moving toward the vehicle. "Lucky for you. It wasn't taught in the army either. I learned from my brother when I was 16. As she worked on the truck's ignition, Jake kept watch for pursuit. "Sarah, I need you to know something. This isn't just about my team being ambushed. We were investigating something big, something that connects to several hospitals across the country." The engine turned over, and Sarah quickly moved to help Jake into the passenger seat. "What kind of investigation?" "Medical equipment being diverted to black market operations. But not just any equipment. Specific items that could be used to treat battlefield injuries off the books. Someone's been setting up underground medical facilities, and they're using hospital resources to do it." Sarah pulled out of the parking garage carefully, avoiding the main exits where security would be watching. "Because we discovered that one of the hospitals being used as a supply source was St. Mary's, and the person coordinating the diversions was using their position to cover the operation." Jake looked at her meaningfully. "Dr. Webb has been stealing medical supplies for months, but he needed someone with the right clearance and access to make it work. Someone in administration, someone with the medical knowledge to know exactly what to take and how to cover the missing inventory. Someone who could authorize equipment transfers without raising questions." Jake paused. "We think he had inside help from someone with military medical training." Sarah felt sick as the implications hit her. "He thought it was me. It would make perfect sense from his perspective. Former military medic, working in the same hospital, keeping a low profile, not drawing attention to herself. When he saw how skilled you were tonight, it probably confirmed his suspicions. But I had nothing to do with any of this. I know that now. But Webb doesn't. Which means he'll keep coming after you until he's convinced you can't expose the operation." Sarah drove through the empty streets, her mind working through the situation. "We're not sure yet. The operation was sophisticated, well planned. Someone with serious medical knowledge and connections was involved." Jake winced as they hit a bump. "But there's something else. The equipment that was stolen. It wasn't just being sold on the black market. It was being used to set up medical facilities for illegal operations." "What kind of operations?" The kind where people get shot and can't go to regular hospitals for treatment. Criminal organizations, terrorist cells, mercenary groups. Jake's voice grew grim. Someone's been providing medical support to some very dangerous people. Sarah pulled into the parking lot of an all-night diner, needing time to think. The place was nearly empty. Just a few long-haul truckers and late-shift workers grabbing coffee. It felt safe, anonymous. "We need to contact the authorities," Sarah said. "With what?" "The people who are supposed to be protecting me are the ones trying to kill me." Webb obviously has connections inside law enforcement or military intelligence. "We can't trust anyone until we know how deep this goes." Sarah looked at Jake, seeing him clearly for the first time since the night began. He wasn't just a wounded soldier. He was someone who had stumbled onto something much bigger and more dangerous than a simple supply theft. "What do you need from me?" she asked finally. "I need to get to my contact at Naval Intelligence. Someone I know I can trust. But first, I need medical attention that won't show up in any official records." Jake looked at her directly. "I need a doctor I can trust, someone with the skills to keep me alive, and the discretion to keep quiet about it. I'm not a doctor anymore. You were never just a nurse, Sarah. Tonight proved that. You saved my life in that trauma bay, then got me out of the hospital when professional killers were closing in. You've got skills that go way beyond anything they teach in civilian medical training." Sarah sat quietly for a moment, staring out at the empty parking lot. She had spent 12 years building a life where she could help people without the weight of military decisions, where she could save lives without wondering about the larger implications of her actions. But Jake was right. She had never really been just a nurse. Tonight had proved that her training, her instincts, her ability to think and act under pressure were still there, just waiting under the surface. "There's a veterinary clinic about 20 miles from here," she said finally. "The owner is a friend, and he has all the equipment we'd need. He won't ask questions. Will he help us? He's a former Army medic too. If I explain the situation, he'll help." Jake smiled for the first time since she'd met him. "I knew there was something special about you. Dr. Webb will realize he was wrong about me eventually," Sarah said, starting the truck again. "When he figures out I wasn't his inside contact, he'll know the real person is still out there. Which means we need to find them before they disappear completely." Jake settled back in his seat. "Think you're ready to be more than just a nurse again?" Sarah considered the question as she pulled back onto the highway. Her quiet life was over. That much was certain. But maybe it was time to stop running from who she really was. Maybe it was time to use her skills for something that mattered again. "Dr. Webb was wrong about one thing," she said as they drove into the night. "I'm not only a nurse, but I'm not just a former Army captain either. I'm someone who saves lives, whether that's in a trauma bay or on a battlefield. And right now, that's exactly what you need." 3 hours later, as dawn broke over the countryside, Sarah finished stitching Jake's wounds in the back room of the veterinary clinic. Her friend Tom had asked no questions, simply provided the equipment and supplies they needed before discreetly leaving them alone. "You're going to be fine," Sarah told Jake as she bandaged the last of his wounds with professional efficiency. "But you'll need to take it easy for a few weeks. Raw. Raw. I don't have a few weeks. We need to stop this operation before more people die." Sarah cleaned her hands and looked at him seriously. "Then we'd better figure out who was really helping Dr. Webb. And we'd better do it before he realizes his mistake and comes looking for the truth." Jake nodded, then said quietly, "Sarah, thank you. For everything. And don't thank me yet," she replied. "If we're going to do this, we're going to do it right. And that means finishing what you started." As the morning sun streamed through the windows of the clinic, Sarah felt something she hadn't experienced in 12 years. The sense that she was exactly where she belonged, doing exactly what she was meant to do. Dr. Webb had been wrong about her involvement in his operation, but he had been right about one thing. She was definitely not only a nurse. She was so much more than that. And it was time the world knew it.